Donald Trump's sweeping travel ban. A new travel ban.
Today I am signing a new executive order placing travel restrictions on countries, but we will not allow people to enter our country.
That it is very important to apply for your visas from your home country.
I think first year all my student match. Last year also I had a very good success.
If I were you, I would use this as an opportunity.
In my country, that is Dominican Republic, is very different than here in the United States.
I would say in the next coming week or a week after that, I believe everything would start getting normalized.
What can you do? I mean, what is in your control, right? Like I said, you don't control the government timeline, you don't control anything, but what can you do? All right, good morning, good afternoon, good evening, everyone, depending on your time zone. So this is a special session that USMLE Sarthi is hosting today. And my name is Pawan. I'm the director at USMLE Sarthi. I'll be joined by a host of speakers here. And one of them you can see on your screen. So his name is Sanjay. We'll go over the introductions in a minute. But just to set the housekeeping and the agenda, we will talk about a lot of visa issues. So social media vetting, some countries have been restricted from travel. What is going on with F visa? What is going on with J1? B1, B2 continues to have delays. So some of those things we'll talk about. That's why Mr. Sanjay, who's a visa consultant, will be here. Additionally, we will talk about what can you do in this uncertain scenario. So I have a series of physicians on our panel who will be joining us. Can you do, online rotations, tele-rotations, online research? How can you take advantage of this uncertain situation? It is what it is. There are things that we cannot control. There are things that you cannot control, right? But even in the times of COVID, even in the times of the prior administration, this visa ban is not a new thing. It was there in 2017, 18. Many of you may not remember, but it was there for about 2 years. Then, of course, COVID, we all remember. So there were always times when there were issues with the visa, when there were travel restrictions, and IMGs have historically done well. It's not that IMGs did not match in those seasons. The match rate was still 50% plus. So the idea behind today's webinar is to outline what the issues are. Can you do something? So if your country is not under the restricted list, what can you do? What do we know? What do we not know? Because there is still a lot of information which is unknown. So to get the record straight, very, very legitimate information that we'll provide. And then, of course, go over some of the things you can do as you plan the match for this season or the next. So my first speaker is Mr. Sanjay. And incidentally, if he does not know anything about visa, it is not worth knowing. He has more than 30 years of experience. He used to work for US Embassy in India. And, he was there, I guess, in the embassy when I took my F1. This is 25 years ago. And he runs a very successful visa advisory company, Reapplying Education. We've been working with him for the past, 3-4 years. He's helped a lot of Sarthi students. He's, whatever you need from India or even neighboring countries from on a visa paperwork advisory perspective, I think he is your go-to guy. And he's going to present his perspective on what is going on and what you can do. So Sanjay, welcome, and all yours.
Thank you so much. Thank you so much, Pawan. And thank you all the participants IMGs who are waiting or trying to understand what's happening during this interim period. What is the White House doing? So I've been doing this presentation now for quite some time because students in India have been really concerned about what's going to happen, what's the future holds for them. So like Pawan said that, I used to work with the US Embassy. I was there for about 15 years. And then for the past 23 years, I've been helping students, IMGs, B1, B2, and a whole lot of other visa categories. And like Pawan correctly pointed out that, the visa ban is nothing new. Even if when we look at COVID, there was a complete halt, and the students who were, had already gotten their I-20s were quite worried. But then gradually things opened up and, things were getting streamlined. And then suddenly we see this pause. So like we all understand that the student visa appointments are paused, So when we talk about student visas, there are 3 main categories, which includes F1, M1, and J1. So most of the students here, IMGs, are possibly looking at the J1 visas. But the good thing is that, the system is just paused because they would like to understand and also expand their screening on social media. So when we talk about what is social media and what are they looking at, it's probably they're looking at what are the students talking about? Are they hardliners? Are they looking at what are their views on the current situation across the globe? And they're trying to figure out whether it's going to be a national threat or not. So primarily they're looking at students or their post which could pose any kind of a national threat, right? Anyone who's on a social media does not pose as a national threat, right? So here we'll be talking about how to navigate the new visa student policy, understanding the implications, strategies for success. I would say in the next coming week or a week after that, I believe everything would start getting normalized. students will start getting their appointments. I understand that students, those who have already gotten their J1, their DS2019, are probably struggling to get an appointment and are stressed out. However, we've seen this in the past, and then in the recent past, there were a lot of appointments which were not available, but suddenly they started becoming available. At the same time, as of now, there's a pause, and I'm sure by this week, the coming week, or early next week, this pause would get lifted, and then those who are waiting for J1 will start getting appointments, right? So when we talk about enhanced social media scrutiny and vetting, what are they looking at? Again, they're looking at what's happening, what are people talking about, what are their views, are they centered or are they towards the left of the government? They're just trying to figure that out, right? Now, the most important thing over here is to note that they're concerned about national security, right? They're looking at potential threats by scrutinizing applicants for their online activities, right? However, I also believe that anyone, because we are living in an age where most of us are already on digital platforms. Having no digital footprint is also not a good idea. A lot of people would rush and say that let me just delete everything. That is not a good idea, right? Because if the government or if the agency wants, they can dig into it and figure it out that you were there on a digital platform or on a social media, and then you had to delete that for a reason. Please don't rush into that. All right. So make sure that you are there. There could be a little delay in the processing. However, like I said, this week or coming week, I'm sure they will start releasing the appointments. The only thing that is happening at this point of time is your stress levels probably would have gone up and not getting the appointment. But like I said, this does not impact the visa decision-making process. It's not that the visas would start getting refused because of social media vetting. It's not true, because a couple of students, I would say about 10 of my students who went for their interviews, who already had their interview scheduled, got their visas, right? So the good news is that if you are overboard, if you have mentioned everything in place, then the only thing that remains is how do you go and convince the officer why do you want to go and do a residency in the US? How would that help you or impact your career goals? All that we can discuss later. But if you have to address the current situation, the only impact at this point of time is increased stress level and anxiety for the prospective students, which I'm sure will go down by probably coming week or the next week. And at the same time, if you look at the other side, the US schools are also possibly pushing to meet the enrollment deadlines, because I understand the IMGs, those who have to report for their residencies, they have a reporting time. I'm sure the hospitals, the agencies, the schools in the US, those who are waiting for the students to enroll and then, of course, start with the fall session, they are also pushing the government. They're also talking to their own senators, their congressmen, and they're also pushing it so that students start getting the appointments at the earliest, right? However, at this time, when there are no appointments, what we need to do is we need to be very, very focused, and we have to stay informed. Unfortunately or fortunately, there are so many Instagram specialists, those who come and talk about various things. However, I would suggest and recommend each student to please go to the source, which is the US Embassy or the consulate website. They keep posting their regular updates. And when you start following those updates, you'll figure out what's happening and when are they going to open up their website to the students to schedule appointments. At the same time here, this is all about the I-20, but here at the same time, if you received your DS2019, fill your DS160. That's the visa application form. Pay the visa application fees, pay your service fees, and keep looking at the visa appointment schedule. And I'm sure in the next week, you'll start getting those things. I always tell each student to please look at their DS160 very carefully. Whatever you mention on your DS160 would stay in the system for 99 years. Anyone who's got a DS2019 or an I-20, they fill their DS160, who's paid the service fees. That's how the data is collected, and the embassy understands the number of students waiting for their appointments, right? So they have a system where they understand X number of students have received their DS2019, they paid the service, and they're waiting for the appointment. So let's say that there are 100 DS2019, and they've already paid the visa application fees and the service fees. So the embassy knows that there are 100 students waiting to get their appointment. That's how they would understand the data and then release the appointments accordingly. Now, social media. So most of us are already on Facebook, maybe on X, on Instagram, or let's say other similar platforms. So please maintain those platforms and maintain your posts. Do not rush into deleting those posts. Please don't. So what I always say is that be consistent. The visa law inherently says that anything done for the purpose of visa becomes invalid. All right. Now, if you have an Instagram page and if it's on a private setting, please make that public so that they have access to it. If it's private, then they may ask you to give your login details and all of that, which is which is again is going to be another step for you to follow. So if that's private, make sure that you make it public. Professional presence is very, very important, that, whatever you achieve, whatever you studied, your activities, make sure that you mention that on your social media platform so that it becomes consistent with what your profile is. If the visa officers or if the agency is checking that, they understand that, you're overboard, you have mentioned those, your activities and your achievements, which are in sync with what you want to do in life or in your career. Very important. Like I said, make sure that you follow the US Embassy Instagram page, where they keep posting regular updates about the visa appointments, what's happening with the embassy, what kind of decisions they're making. So make sure that you follow that so that you get the right kind of information right from the source, right? First thing is this is just a pause, right? It is not that, it is going to be closed or they're going to stop issuing visas. It's not that, right? So again, when there are issues like this, so we have to be extremely flexible in finding out what are the policies. We have to be a little proactive in terms of finding out when are the appointments going to get released. Complete all your DS 160, DS 2019, pay the visa application fees. Be ready. As soon as the appointment gets released, you can start scheduling the appointments. So this is a small presentation that, talks about what you need to do and what you don't need.
Thank you for that. So it was a very good brief, very concise presentation. I will take a couple of questions and then as they digest it, maybe towards the end. So one question which I can see is on H1B. So H1B, if they are, say, starting a residency or something on H1B, H1B is not impacted in any way. Is that correct?
Absolutely correct. It's not been impacted. The appointments are available. Again, there could be a little struggle, but like you correctly said, it's not impacted under the current pause.
Okay. And when you say, so, interviews will resume, if the countries are not on the restricted list, the interviews will resume globally, correct? After they figured out the social media vetting. It's not only
absolutely, you're absolutely correct. It's not only limited to India. Once they expand their, internal policies to vet those systems, and it's going to be available across the globe, not only just India. Correct.
Okay. And one question before we kind of move it is, for the restricted countries, let's say pick any on the list, let's say Afghanistan, if they have H1B, is that impacted or no? And I don't know if we know the answer yet.
Well, not yet, because they're currently just talking about the F1s, and they've also said that anyone who already holds a visa may have restricted travel, but they are allowed to travel. But I have not read that very categorically whether the H1 would be impacted on this or not.
Okay. All right. Sarthi students do get discounted services from Revata. So if you are interested, let us know, let Sejal know, and we'll connect you with Mr. Sanjay. Like I said, he is a pro in these things. So if you are in India or one of the neighboring countries, or even otherwise, if you need advice, we are happy to connect, and all Sarthi students do get discounted services. So now let's talk about what can you do? I mean, what is in your control, right? Like I said, you don't control the government timeline, you don't control anything, but what can you do? If the situation worsens or, maybe you don't get the visa, then many things can be done remotely. Obviously, step 1, step 2 CK, OET, you cannot do step 3 remotely. Of course, step 3 has to be done in the US, but everything you need for residency match on paper can be done remotely. Step 1, CK, OET, tele-rotations, and research. Some of the main components can be done remotely. And that's where I wanted to kind of go over some of the things that we have been working with our physicians to provide discounts to you in this uncertain situation. So let me share my screen and let's first talk about clinical rotation. So if you go to our page here on clinical rotations, you will see we have rotations, obviously on-site rotations, inpatient, outpatient, all of that is there. There are a lot of tele-rotations. That's the first thing I wanted to tell you. There are a lot of tele-rotations for those of you who cannot travel this year, next year. If you click here on Sarthi rotations, and Reshma can put the link, so you will see right here, it'll open up an Excel sheet. You can see all our rotations listed on column B. And of course, it links to the description. So you can read the description by specialty, state, everything, LOR type, you can see EMR access. And then the thing here is a lot of our physicians, if you look at column I, even in June through September, after all this visa thing happened, they have opened up for discounts. Now, some of them are on tele, some of them are on-site, but if you look at column I, you will see which rotations are offering immediate discounts between June and September. Varies from $100 to $500. So if you are interested, first take a look at that. Second, obviously, look at highlights of the rotations, because highlights and then patient interaction. For those of you doing only tele, even in tele, you may have patient interaction. So Sejal has been working on this. So thank you for that. If you look at this check mark, so that means those rotations offer patient interaction even in tele. So for those of you who cannot travel, some of these rotations are very, very useful, tele-rotations. And even if you can travel in this uncertain time, we've been able to get you some discount. So hopefully this will help, right? The other thing which I wanted to point out is on the visa support. So assuming things proceed, what can you do, right? So we do have this visa support page for IMGs. We have end-to-end service. So for example, if you need a visa letter, right? If you need a visa letter, it can come from either the clinic or the hospital if you do rotations with us. Sometimes they are full or they cannot offer it, then we can offer it from our US law firm. We have a law firm, they can offer it, or you can get from Sarthi letterhead also. Okay, so that, and then of course, if you need support in India or neighboring countries, Revata can help you get the dates and all of that, right? So India or your home country thing is also covered. The other thing you have to note is visa letter type. So many of you will ask us, I want a physician letter versus lawyer letter. If Reshma can post a link to this page where you can see if the physician is offering. So a lot of physicians are offering a visa letter, as you can see. Of course, there is a fee to it, and then there are rotations where US law firm or Sarthi letter can also be done. All right. So some of the things we wanted to highlight to help you guys navigate this kind of uncertain season. Okay. So visa letter and of course everything around visa, whether it is clinical rotations. And then, of course, finally, I did want to talk about the research. So if you go to our research page right here, the two important research is the concept to publication. This, if you go, we work with the Director of Clinical Research at Hackensack, Dr. Simca Weissman. You may have seen him in our webinars. Everything is remote. You can actually do a combo, remote rotations and research. And of course, if you go to this page, you can get all the information, and Reshma can also post the link. But the other is, the IRR, Innovative Residency Research, where they are offering $500 discount at this point. Again, given the situation and all, it's all remote, and they are offering discount of $500 on their course. So by September, you get a manuscript and an abstract, which you can use for research on your ERAS. So take a look at both of these as we are, trying to help out. The third, of course, is the CIB-NP research. Reshma has just posted the link. Take a look at that. We will take up questions on that. Now I pause here and I want to take questions. So keep posting the questions. So remember, can I do tele-rotations whole working at my primary job? And the answer is yes. It also depends the time for the tele-rotation and the type of tele-rotation you end up doing. Like Sejal, as was pointing out, there are tele-rotations with patient interaction. Now, patient interaction only happens during the US time when patients are there, right? 8 in the morning Eastern or whatever the time zone is to 5 p.m., right? So if you want to do patient interaction, you have to adjust those times. There are some tele-rotations that are done in the US evening time, especially hours in Chicago. There are some which are handled by the program directors, maybe even during the lunchtime Eastern. So depends on when your job is, but you can do these tele-rotations. If I am accepted for clinical electives, how can I apply for visa? So how can you apply for visa? if you are accepted, again, I don't know what you mean. If you are accepted, it is through Sarthi, we can help you. Otherwise, of course, follow the directions from your school. Have any students successfully matched into residency with only tele-rotations and no in-person rotation? And good questions. And the answer is yes. Each year, we do have students who have matched only with tele-rotations. But let me make it very clear. Each year, this happens. And I don't know if Sejal or my team has the link. And we have had YouTube videos also on this. So the answer is a categorical yes. And I expect this to happen this year as well, given all the uncertainties, right? So that will be there. And what questions can I expect in the visa interview? That Mr. Sanjay Kaushik will take. If you've been rejected, all those questions he will take up. So any visa related questions we will handle after the physician panelist is done. So I think Dr. Jagrati Gohel has joined us. So I did want to introduce her and make sure that we can get insights from her. So Dr. Gohel, welcome. She is a family practice physician with more than 17 years in New York, and she's affiliated with Garnet Health and has helped a lot of our students every year. I think for the past 2-3 years, one of the best rotations that always we have great feedback on her rotations. And she's been very passionate about helping IMGs, especially because a lot of programs look for rural setting experience, right? So she brings that to the table, has been helping personally each of the students. In fact, some of the key aspects of her rotations is not only her rotations, but the housing that she provides. She treats each of the IMGs as her own kid, and she goes out of the way to help them. She has tele-rotations as well. And, we wanted to get her perspective on how IMGs navigate this situation. So thank you, Dr. Gohel, for joining and for sharing some of the tips with the IMG students in this uncertain time. So let me start off by asking you, can you describe a typical day in the life, when someone is rotating with you? Typical, what happens in the day?
Hi there. So I've been here many years, and I got to know about Sarthi from one of the students only. Actually, he was a son of one of my friend, and he's like, so he was just coming to meet me, and I took him to my. I was like, you are here 2 days anyways. Let me show you my office too, And he's like, what is this? Like, he was able to observe almost 70 something patient that day. And he's like, this is amazing. Why don't you start also? And that's how actually I started Sarthi maybe 3 years back. And I think first year, all my student match. Last year also, I had a very good success. And even my tele-rotation, I think 2 or 3 students from tele-rotation match. And one of my tele-rotation student was able to actually do poster presentation. And there was a huge success for her too. So usually, most of the students who does the rotation with me, I have created a space in the house that they just live with me. And advantage of that is like, it's one-on-one. I get to know you more. And I have a very tough life in the past, so I have a different perspective to life. And so you get to know me that way. And my talk definitely will be inspirational. I can promise you on that. And I during the ride to work, coming back, we talk about the interview prep, what to do. Most of the students, I also help them personalize their PS. I help them what should be in the LOR, all those things. And then we start our day around, so it's a 5 days a week rotation. But if you are studying for step 3 and so, you do tell me, and then I go accordingly. Like right now I have 3 students, and they are coming 2 to 3 days because they are saying that we have good exposure at work. So, but we need to also study. So then I take them 2 to 3 days, and the other days, as per their request, I have tell them that, okay, stay home, and then you study those days, So usually we start so if my patient is admitted in the hospital, then we get to round on them. And then you go to the clinic, and clinic, I'm a very, very, very busy. I'm actually like an Indian, one of those Indian provider in India, OPD, seeing 70, 80 patients, sometimes goes up to 90, and where it includes urgent care and primary care. And I work 2 places. I work in Allenville, which is rural, and Middletown, urban. So in your CV and LOR, you can definitely put two different experiences, right? That I have a rural experience and urban experience both. Also, you put like hospital experience, urgent care experience, and you will see me treating like generations. I have 3-4 generations of patient coming to see me, from grandma to like granddaughter. Everybody I see. So one of my student that match, right, when she went for an interview, and she was so up to date with all the new testing and criterias and all those things that even cardiology rotation, right? In FM, we have cardiology rotation on first year. The cardiology people were ready to take her. Like, do you want to try to come to our program next year? Is that good? Like, I am very up to date with my all the criterias and new medicine. As I see more patient, of course, I am a prime market for all the new drugs that come out. So all the drug companies, I'm their prime market too. So they come and introduce all the new drugs to me. And so all those things, you will be up to date. And patient interaction. And of course, I didn't start seeing 80 patients a day on day one, right? Like, there has to be, you will learn how to talk to patient, what attracts the patient to you, right? First, honesty, right? I don't want to be treated, I will not treat any patient how I don't want my mom to be treated. You know what I mean? So so honesty, hard work, and like other than outside of the clinic, when you are with me, I will teach you like what they want in the interview, what they are looking for a candidate. Of course, one thing you will learn from this rotation is hard work. No matter whether you do it here, outside, doesn't matter. But that's the thing. And on Saturdays, sometimes I do urgent care. And with urgent care, I like to make my time most productive. If I'm away from the family, I need to be making money, doing things. That's how so I do the urgent care, and urgent care based on a patient, right? Whether sometimes it will be busy, sometimes it won't be busy. So what I do, I also schedule telemedicine that day. So when it's not busy, we do the telemedicine in between. So you are constantly exposed to some kind of medical knowledge in my rotation. So first week, you usually come with me room to room, and all my patients are my patient for like 17, 18 years. So they're like a family. And they don't mind 3-4 people even coming in. And I don't take too many students. I only take like 4, max 5, but no more than that. And so you can all come in. So first week is all observation. Come with me. So that gives you idea about what is my expectation, what are the medicine I usually use, what are the testing I usually do, like what is and patient gets used to students too in that 1 week, and staff gets used to. The next week on, you start seeing the patient yourself, like get the patient ready and present the case to me. And we discuss the new guidelines, medicine, criteria, all that. So first week I give laptop to my students. So when you walk in with me on a first week, even if it's observation, you have a laptop right in front and you are actually accessing the EMR. So that way you are learning the EMR also in the first week. So it's pretty good. One good compliment I got from one of the students who matched. That was her third attempt actually, and last year she matched. And she said that, ma'am, after your rotation, I feel like I'm ready to go out and start practicing. So that was a good compliment. So that is what I can guarantee you. My rotation is not just for your residency prep, but it should stay with you forever. The family practice that is portrayed in United States and outside of United States, I have changed how it works. My patient will not take any specialist medicine unless they consult with me. You have to create that much trust in your patient, and you will learn that from me. So all those things I do.
So thank you, Dr. Gohel. This is great. By the way, Dr. Gohel, also many students need IM, FM, that combo rotation. So she also coordinates with other physicians. Reshma can post the link of all Dr. Gohel's rotations, including the combo rotations, IM, FM. So Reshma, post the link because I think many students will be interested. Dr. Gohel, talk a bit about tele-rotations, because given the situation that is evolving on visas, many of my students may not be able to come now to the US, or their travel is going to be delayed. So how will you tailor the rotation for a tele setting, so someone say sitting in Afghanistan or India or Egypt can make use of it?
Okay, so tele-rotation, so same thing. You will be having a view access to the my EMR, right? And I will go in the room, introduce myself. You are listening to me continuously while I talk to the patient, right? And then you will see what labs being ordered. When I review the lab, you are also reviewing the lab along with me, and making the you are seeing me making the changes. You will hear about all the new medication. And when I have telerotation student, I keep in mind all the time that when I prescribe the medicine, everything, then same time, even in front of the patient, I just tell my student that this is this medicine is this, and this is why I'm adding little teaching, like 30-second 2-minute teaching every few minutes is happening continuous, and one of the student created like a PDF on all the medicine he learned and the disease and criteria, and he had written 198 medication with new criteria, everything. That was amazing. So I use that table and send it to all my telerotation students, so it helps them out too. And when I have a specific physical finding, right, then just like rash or some typical rhythm or something like, then I turn on the video, I show you guys that this is the rash I'm looking at, and this so, and I have a group actually for the telerotation, and you post a question in there, I answer it, I post a picture of anything particular, and if you see any particular case, then you can do the case report. That's the other thing I forgot to tell you guys, that students do get to write case report in my rotations, right? Because when you see like any important case that we can write or poster presentation, like my students are currently working on a press syndrome poster presentation. They are going to AFP meeting in Kansas, and maybe API meeting is also happening in Ohio. So they are planning to do the poster presentation there.
So this is so students in your rotations can also do case reports. Yes. And obviously, submit. So this is great. I mean, something that each one, and including obviously the tele-rotation students,
yes,
they will be able to do it also.
The student that matched last year, she did a poster presentation in IMG meet last year that happened in New York City, right? So she had a poster presentation on a sarcoidosis of the scalp last year. Okay. And, so that was pretty nice, yeah. So telerotation is as much effort you put, right? I think I am putting good effort. For me, on top of the history taking and all that you learn, I think the medical knowledge, now you guys all prove that you know how to take history. It's like you need to know the medical aspect now. So you learn that quite a bit from me. And I guarantee you that you will be more educated, everything, and more ready for the US residency after my rotation, yeah.
Well, thank you, Dr. Gohel. Always appreciate your work for IMGs, and I'm very, very impressed, and I'm sure the students will really, really love the way you're passionate about IMGs. So thank you for spending time today. We appreciate it, and we'll be in touch. So anyone who needs Dr. Gohel's rotations, take a look at what Reshma has posted, and then we will go from there. So thank you for your time, Dr. Gohel. Appreciate it.
Good luck, everybody. Yes.
Thank you. All right, so our next speaker who may be joining, Dr. Amit Korea, I'm going to wait for him. I think he's joining. So once he joins, we'll talk. But let me take some questions meanwhile. And the question is, and this is a very important question, will the program directors this season overlook or deprioritize non-US IMGs during the application cycle? Additionally, how may this impact the situation? So I will take you all back to COVID or even the 2017, 2018, if you were there. So there are a few things that we all have to kind of understand. In this situation, yes, if you are already in the US or you have a B1, B2, you can travel, etc., you will have an advantage. So it's not only US citizens, green card holder, even people who are here in the US, say on a J or a H1B, B1, B2, H4, definitely, because programs are not clear on how policies will evolve. So that advantage could be there for sure. However, if history is any guide during COVID, or like I said, 2017, 2018, it does not mean that the visa seeking IMG who does not, or who's been not able to travel because of this visa dates and all, it does not mean that they will not match. They will also match. So you just have to be very, very smart about these things. Tele-rotations, tele-research, things that you can do. I think those are important. Networking is going to be very, very important in these cases. And So a lot of things that we will talk about, and as Dr. Korea settles down, I also want to point out that we do have a lot of classes as part of our residency match plans where we talk about networking. How do you send an email? How do you use LinkedIn? So there are detailed classes that we host on each topic of our residency match advisory. So as part of the platinum, gold, bronze plan. So that is one. There are discounts. There are various discounts that Sejal can also post on our match plans, and there are limited spots left. I think if someone is applying this season, there are very limited spots left in our gold and platinum. So if Reshma or Sejal, you can post the link. There are some discounts. I think $100 on platinum, $75 on gold, $50 on bronze. So if you are really interested in understanding how program directors will view all of this, we have regular classes which are not on YouTube. So we have Telegram group where we answer all these questions. My panel answers all these questions. And we also have one-on-one meetings which you can hold with me. So that's that. And for those of you applying maybe next season or still in doubt and all that, there is a flexible residency plan that you can look at. You can get started. Reshma will post a link. Again, all classes are live. You have access to a lot of material, setting up time with me, and also take a look at that. And we'll talk more about it as we go through the webinar. But it is my pleasure to welcome Dr. Amit Korea, who has just joined us. And again, he's also one of the physicians who's been very, very passionate about helping IMGs. He's been helping our students in both the tele-rotations and on-site rotations, of course. So someone who we really highly value his perspective on how to navigate this kind of uncertainty. He has been helping our students, like I said, for the past 3 to 4 years. He's a hematologist oncologist, and he's a director of HEMONC and teaching faculty at MD Anderson. So he knows a lot about the IMG challenges. So Amit, welcome. And if you can help some students talk about how you are preparing or how you are helping IMGs in this uncertain times when visa is an issue. And also let's maybe talk about your tele-rotations or how you can help students in this situation if they don't have a visa. And then of course we'll talk about the other side of things.
Hello, everyone, and thanks for that introduction, Pawan. I'm really very passionate about, trying to help you all and see how I can do the best to move your future forward. So to start off with, let me tell you, I think this is a golden opportunity for all of you all, because in the US, they've actually become very strict with regard to certain countries, like, certain Afghanistan, to some extent, Pakistan and things like that. So if you think about it, in a way, this has actually reduced the competition for you all. A lot of the programs do not want to rank or take candidates from those countries. So actually, if I were you, I would use this as an opportunity, because in 2016, when the first Trump administration was there, actually a lot more Indians got in to residencies in 2016, because a lot of programs, because I was the chief resident back then, wanted to take students from countries other than the countries where there were travel bans or there was visa uncertainty. So I would think this is a big opportunity. And I don't want you all to look at this negatively, but actually look at this as a positive, and how you're going to increase your chances to match over the next maybe 2 or 3 years because of how this may work out in your favor, right? As far as the tele-rotation is concerned, my goal is that you don't have to necessarily be here. It's very important to have US clinical experience, and that's what I'm trying to provide through the tele-rotation. What is also exceedingly important is that I try and give you all some research projects to do, and a lot of the students that have worked with me, we do get a few papers published. Invariably, in the 1 month that they work with me, we have a case report or a case series published, which is then published in a good journal, which is something you can talk about during your residency interview. So I think if you can do a rotation in today's day and age, get a letter from a big university. Very, very important. You do not want to be getting a letter from a community hospital, someone in private practice or something like that. If you can get a letter from a big university, University of Texas, MD Anderson, Mayo Clinic, something like that, it adds 5 times more to your application than trying to do a rotation, in a not so good place. Even if it's a tele-rotation, if the letter is from someone from a top-notch institution, it makes a very big difference. 1. 2, if you're able to get some publication out of that, if you can get a case report or a case series out of that, out of working at the University of Texas, that adds a lot to your application as well. And I'll tell you honestly, I was talking to a lot of my students who matched, and all of them told me that very often the program director would be like, I read this letter from MD Anderson, the University of Texas, tell me about this rotation. So they may have done other rotations as well, but very often the focus is, how did this rotation go? What did you do on this rotation? What did you get published on this rotation? And how can this rotation help you be a better resident moving forward?
So this is great. Again, guys, it's important to understand that in tele-rotation with Dr. Korea, you can also do research, and obviously, like he said, the letterhead makes a lot of difference. So Reshma, if you can post that link for Dr. Korea's both on-site and tele-rotations, I think that will be helpful. So let's talk a bit about, day in the life, right? So Dr. Korea, if someone is doing only tele-rotation because, there's a pause, etc. on visa versus they cannot travel. So how does a tele-rotation work out? For what do they do on a weekly, daily basis?
So to start off with, when we do a tele-rotation, very often I want the students to go through the same academic process that someone who's a resident or a medical student or a fellow at the University of Texas goes through. So invariably, the day starts with a conference in the morning. It may be a case presentation, it may be a faculty lecture, it may be an M&M meeting, mortality and morbidity meeting. So I make sure that they have access to attend those meetings, right? So that's a very, very good start. And that's a time that you can actually network. You can, when they ask questions, if you're smart, you know about those things, you can talk about it, and then you get noticed. So that's important. So I do that. Thereafter, if you're rounding in the hospital, I'll make sure that you all can participate with regard to table rounds, where we typically the fellow, the resident, the medical student, the fellow from MD Anderson, the resident from the University of Texas, and the medical students from the University of Texas. We all accumulate. We talk about the patients, and then we go and see the patients, and then I'll have you see 1 or 2 patients with me over a video call. So you get the entire gamut, I would say, because you get to attend the conference, which is exactly how medical education moves forward in the United States. You get to participate in rounds where you get a chance to see how the attending, the fellow, the resident, and the medical students interact. It also gives you a good idea to understand the roles of the various members of the team. You understand what a medical student does, what a resident does, what a fellow does, and then what the attending does. So it gives you a good understanding of the US healthcare system. Oftentimes, we also have social workers and case managers and things like that, which you do not have access to in India. So you do not know what's the function of a social worker, what's the role of a case manager, right? Sometimes what's the role of a pharmacist, right? We also have pharmacists on our team, right? So this is a very good time to understand that the team is way beyond just physicians. We need to take care of a patient in a very holistic environment. And that's the reason we have social workers, because the role of a social worker is when the patient is discharged from the hospital, when the patient goes back home, is the discharge safe, right? Is the patient ready to leave the hospital and go back home and be safe? So that's a very, very important part of decision making in the United States. It's not like the patient's a little better, let's send them home, but we need to make sure the patient's safe at home, and we need to make sure the patient doesn't get sick again at home to come back into the hospital. A good example is, let's say a patient has bacteremia and you start the patient antibiotics and you need 10 days of antibiotics. After 4 days in the hospital, the patient is stable, the patient is doing well. You don't need the patient to stay in the hospital for the entire duration of 10 days. So what we'll do is we'll send the patient home after 4 days, right? And then we'll set up someone to go to the home and administer those antibiotics, because we don't want the patient to come back with an infection, right? But we don't need the patient to stay in the hospital for 10 days. So that's a very good example of how the social worker and case managers help set up those services for us so that a patient is discharged safely and they can get their medications at home. So I think when we include these other folks during our rounds, it gives you a very good idea of how the healthcare system in the United States works and how it may be different from the healthcare system in India or other parts of the world.
Okay. Well, this is great. And, before I let you go, one question that students always ask, what should I be prepared for before I start a rotation with you or anyone, but especially with you, either tele or on-site? What are the basic minimum requirements or prerequisites that?
So, I really simplify it. And all I say that I want you all to have is a whole lot of enthusiasm. And I want you all to have the attitude to learn. There's really nothing that I want you to prepare, but I want you to be as involved as possible. If you have been told to attend the conference at 8 in the morning, I want you to attend the conference. I want you to participate in that conference, right? If they're asking you questions like, okay, what do you think is the differential diagnosis for this patient? If you know the answer, speak up. If they say a patient came in with shortness of breath and the patient, took a long flight, and they say, what do you think is the differential? If you think it's a pulmonary embolism, let them know it's a pulmonary embolism. Participate. That's some way that, people recognize you. You may think that, okay, I just answered a very basic question, but very often people notice that, right? So I want you to be enthusiastic. I want you to participate. As long as you have the enthusiasm, you will do well. You don't really need to prepare, because most of you all have already done your step 1, and some of you have already done your step 2. So your medical knowledge is good. And you guys are IMGs. You guys are smart. You guys are very, very, very smart. So really, I want you all to just have the enthusiasm, and I want you all to learn a new system. It's not just all about medicine. It's about understanding a new system. Like the example I gave you, how will a patient get the next 6 days of antibiotics at home? How do you set that up, right? So things like that, I want you all to learn.
Yeah. Well, thank you, Dr. Korea. Much appreciated. And by the way, there are excellent reviews of his rotation, so maybe Reshma can post some of that. All our students who've been with him speak very highly of the experience. So that's that. And if you need help, of course, with his rotation, Reshma is going to be posting the links both for tele and on site. So thank you, Dr. Korea. Much appreciate your time, and we'll talk to you soon.
Alrighty. Thank you, Pawan, and thank you, everyone. Look forward to hearing from you all. Bye-bye.
Thanks. Bye. All right. So, now let's get back to some of the questions, and probably I'll get Mr. Sanjay Kaushik back as well. So he and I will team tag. So one of the, and now you can start posting the visa questions. But one of the questions is, someone from Afghanistan is asking, it's a bad situation for us. So yes, of course, a ban is a ban. There's no two ways around it, but the least you can do is not do anything, right? So be prepared from whatever you can do, whether it's step 1, whether it's CK, whatever you can do in your country, whether it's tele-rotation and research. And like I said, students have matched with only tele-rotation experience, tele-research experience. That always has happened, and that will happen. So it's unfortunate that some countries are on that, the 12 countries plus 7 on that list. They are up there. We'll talk to that. Okay, I just realized that Dr. George Vermenton is. Yes, so thank you, and it's my pleasure to welcome Dr. Vermenton. He is also an IMG, and he's been helping our students quite a bit. I mean, he's a pediatrician based out of New York. He did his residency at Lincoln, and absolutely fantastic feedback on his pediatric rotation. So Dr. Vermenton, let's talk about day in the life of your rotations. What do students do when they come to you? Probably we'll start on site, in person, and then the tele-rotations.
Okay. Well, as we already mentioned, I'm also an IMG, and I'm from Dominican Republic. Yeah, on site, because I'm a pediatrician, you will see whatever you see in pediatrics on a daily basis. We usually see kids, and we address growth and development. The kids are usually in a normal state, meaning that you're gonna see a lot of kids that are normal and growing well. So you can identify the ones that have any problems, because usually we see pathology, meaning something that you can address not in an emergent or urgent care, but we see also certain pathologies. On site, usually you will not only address medicine, also you will see the business side of my practice. So I think it's a very interesting place to rotate, because you not only see the hospital side, only the medicine side. You can see how a doctor that has his own practice living in United States.
Yeah, and of course, pediatrics has suddenly become very, very important, and a lot of IMGs are applying to pediatrics nowadays. So it is something very important. Now, Dr. Vermenton, when it comes to things like EMR access or patient interaction, How do students manage that in your rotations?
That's an excellent question. So usually you are, after they take the vital signs, you are like the front line of my clinic. You will check the patient. You have like a lot of autonomy. So you will take your history, check the patient, do the physical exam, and then you're gonna come and discuss it with me. Usually it's like a hands-on rotation where you come and you come with ideas. Oh, you see, I see this patient that has this rash. This rash is like this, yada yada, and we discuss whatever it can be. We do our differential diagnosis, and then I will go with you and do my own physical examination. I will address the patient, and then I will tell the patient what is my idea, whatever is going on with the patient, and then we can discuss it afterwards. It's a very hands-on practice and rotation.
Okay. And how does it change in the tele-rotation setting? What can a student do, not do when it comes to tele?
Okay, telerotation is very interesting for me because usually you will see all the process, and then at the end we can discuss whatever you already saw. Meaning that you will see the there is another student probably hanging out with the computer. Is going to put it in front of the patient and the examination table, and they will discuss like everything, and you will see whatever the student is doing. Then you will come with the student to my office. We can discuss all three, whatever like we saw. You can like give your opinion. Oh, you did this question or you missed this question. I think we should ask this question. I think this patient may have this, and then I will go with the student and the person who is in the tele-rotation, and we will address the patient, and then afterwards we can discuss whatever you want. Also, there is at least 1 to 3 days in the clinic where I sit down with the students, also with the tele-rotation, and we can discuss any case or any topic that we can discuss.
Yeah. Well, thank you, Dr. Vermenton. This was very, very helpful, and I think your rotations, both tele and on-site, really help the IMGs. So appreciate your time and appreciate all the help you give to the Sarthi students.
Thank you very much. It is my pleasure, and it is an honor.
Thank you. And we'll see you in one of the other webinars soon. So thank you.
Yes. Okay. Any other question?
I think they are okay. There is one question I will maybe ask you. If a student is planning to dual apply in internal medicine and pediatrics, so how do you suggest they plan for it?
Okay. I will. Usually, like you can apply. There is no problem with that. How can I tell you that? Let's say that I applied for pediatrics, but I did a rotation in psych, meaning that it doesn't matter where you rotate. You just want to know the system, how it works. Because in my country, that is Dominican Republic, it's very different than here in the United States. I haven't had the pleasure that, probably address how medicine is like in every country. But the most important thing is a couple of things, right? One thing is like, how is the system? How you can adapt quickly to the system? And also, what is the quality of life that you're looking for? Because I'm in New York. It's very diverse, and you get like a lot of experience, not only medicine, also the way of living, because probably you come from a very conservative country, and when you come to New York, it's like quite different. So it's always good to have the experience, not only the medical experience. Always is good to also know how you will live in United States, because like a lot of students, they are super good in whatever medicine related topics, but then they fail to adapt the system and the way of living of United States. And it's very important that because it's a big step, it's very important that you come, you see what's up, and you say, okay, I can live here and I like this.
Yeah, I think adaptability is very, very important. So
Yes.
Thank you, Dr. Vermenton. Much appreciate your time. Thank you.
My pleasure, and I hope you all have an excellent day.
Thank you, sir. All right, let's move on. And now I think we can get back to visa questions and other questions that you may have. So if Mr. Sanjay Kaushik is there, so we'll team tag. and I'll give you some questions and then I'll answer some. But before we do that, I wanted to remind you, we do have an open Telegram group that anyone can join, and Sejal, you can post that link, and our physician panelists handle that. So any questions on all aspects of the USMLE journey, you can put in there, and they will answer. So this is a new kind of a service that we have started with for all of you who may have questions about your USMLE journey, whether you are in MBBS 1 or applying for residency, completely free. Okay. So she's already posted it. Thank you. Okay, Sanjay, a question for you. And this is where now we are getting into some of those details. Previous B1, B2 rejections. What do I do to ensure that I'm accepted next time?
Okay. The first thing is for interviews for US visas, there's no guarantee. However, because of my experience and with good 39 years of experience, what I understand is that a rejection is not the end. I've seen a lot of people go in for interview maybe after 2 or 3 rejections and still getting visas, because probably when you're going in for your visa interview, sometimes the answers that you're giving are not the most appropriate answer that the visa officer wants to understand. So we have to look at everybody is different. Everybody's background is different. Their ultimate goal of achieving their career goals are very different. So the most important thing that I tell everyone is that you should start your journey by looking at what are your end goals. If you want to be a pediatric, you must understand what's happening in the pediatric field in India and what's lacking in India. What are the gaps that you see? And then if you start looking at your journey, why you want to go and study in America, why do you want to go and do your residency, what will you learn there, and then link it with India, then that's how you show your intentions, not only to go and study in America, but also why would you return back? Yeah. Most of the time when students are going for their interview, because of the social media, and there are so many specialists coming and making their reels, saying that you should be very brief. I do not believe in that. You have to drive the interview. You have to provide relevant information voluntarily. That's how you go and navigate the interview. Not just saying that I want to go and do my rotations. That's not enough, right? So anyone who's got a visa rejection is not the end. I need to figure out what happened during the interview. How did you frame your answers, and how we can better it next time.
Okay. Another question. If I have previous rejection on B1, B2, but let's say I do all this tele-rotation, tele-research, I match, will this impact my J1 approve? And hospital is giving me a J1. Will this impact the previous rejection?
Okay. So if you understand what I just said, is that the visa officers want to understand your intentions, right? Let's say that unfortunately your B1, B2 get refused, but then you showed your intent to do your rotations online, you do your tele-rotations, you get good LORs, and then you've matched and you've got your J1 from the hospital. That clearly indicates to the officer what are your intents, right? That your intention was not really to go to the US, but to upgrade your skills. So you've already proven to the officer that your intentions are to bridge the gaps and learn new techniques for your betterment of your career. So how do you use that during the interview is very important. So once again, like I said, B1, B2 is not the final thing.
Okay. Okay, sorry. One question, and I don't know if we have the framework yet, but someone is asking, given the social media vetting, what questions can we expect regarding our social media account or any other related activity? Okay.
So if I go back into my experience with the embassy, because I was not only working there in the visa section, but I had experience from non-immigrant visas where all the F1, H1, J1, all the visas were issued. Then gradually I moved on to the anti-fraud unit, where we used to, when there was no social media so prevalent, but still we would go ahead and check. So what were the checks? The checks were criminal backgrounds. Are you a national threat? If you're just posting your views on a particular subject, that's fine. The vetting is primarily to see if there's somebody who's posting something which is anti-national. So please, like I said, if you are already on social media, if you have tagged to a nice, interesting meme, that's all okay. It is good to be on the social media platform so you can interact. But what they're looking is your hardliner views. And Pawanji, with the experience of 39 years and with your experience, I know that our Indian students are very centered. We don't try and indulge anything which is against anyone in terms of hardlining. So we're very centered. So just be normal as possible as a kid would be. That's what I would suggest. Thanks.
Yes. Yes. So, by the way, Sejal has posted students who are matched with tele-rotation only. So, take a look, and maybe Sejal, you can post it again. So that, and meanwhile, obviously, we have a lot of results on our results page. So, if you can just go to the results page, match results 2025 here on the website with Sejal or Reshma. You can post the link so you can see old YOG, recent YOG, all that categorization, visa seeking, things like that, plus the links that Sejal is sharing on matching with only tele-rotation. So people who have not gotten visas last time. A couple of other questions, Sanjay. Now, for many students, obviously, English is not their prime language, and fluency is an issue. Can we use our native language for visa interview, or it has to be English?
Oh, definitely, it has to be English. Because we talk about a very, very serious and a committed profession that we're talking about. The visa officers are not only looking at not only your credibility, your credentials, but also looking at your spoken and your understanding of English. You will be treating a patient over there. So there has to be a clear communication between the patient and the doctor. And during the interview, if you're choosing a language which is not English, is creating doubts in the visa officer's mind whether you can actually go and, understand what the patient is telling you.
Okay.
So I would suggest and recommend it has to be English.
Okay. How do we prove strong home country ties? This is a question that comes up again and again.
Oh, yes. I can understand, because the 214B, which usually a person would get after the interview in case if their visa is not issued, shows or tells that you did not show enough ties to your home country. So there's a lot of confusion around that. So let me just clear that very clearly for an IMG or for a student. The most important thing for them to show their ties to the home country is your professional goals. Not that, I've got my aging parents here, my parents are going to retire, or I've got tons of property here. All that is fine. But you going and spending and investing your time, your energy to understand and learn new skills. Where are you going to use that skill is very important. So how do you frame the answer that tells the officer that you've got intentions returning back is very important, right? So your first answer, so let me tell you, Pawanji, when I interviewed a lot of students, when I asked them, why do you want to go to the US? Their first answer comes in, I want to go and do my rotations in the US, right? Now, we assume that the visa officer understands what is rotations, what is elective, or what is observership. No, he doesn't. Look at his day. He's interviewing a person who wants to go and study in the US, who wants to do, let's say, computer science, aerospace engineering, biochemistry. And then suddenly you see the person going in for business and somebody going in for meeting his relatives. And then there's an IMG saying, I want to go there for a rotation. So, like I said, a lot of information that is online says, be brief. No. Tell the officer, sir, I'm a medical graduate or I'm finally a medical student. During this time, I have this option to go and do my rotations in America to understand what are the global protocols that I can incorporate in my practice once I return back to complete my MBBS here. So you're telling him you'll come back, right? Even though if he's not asking you. So you're putting that in a kind of a format which tells the officer it's more like a conversation. You're not pushing the envelope saying that you'll come back, but showing your intent. Yeah. And then the visa officer can ask you, why do you want to do, let's say, rotation in pediatrics? So the answer would be, sir, if I talk about only Delhi only has one hospital for pediatrics, the Kalavati Hospital. However, if you talk about all the hospitals which are coming up, they have a special department. But if you talk about prenatal, postnatal, or natal care, it's not there. So you're showing that gap to the officer. So indirectly, you're telling him, why will you come back? That's how you frame your answers to show your intent to come back.
As you can see, Sanjay's knowledge of IMGs and healthcare is second to none. So thank you for that. All right. So question is,
you and all your students. I've understood what is nephrology, what is IM, what is intervention cardiology. All this was alien for me. But thanks.
Yeah. No, good. Do you have pathology tele-rotations? Yes, we do. Reshma, you can post the link. So pathology tele-rotations. Okay. Then Sanjay, the question is it okay to have only one social media account like Instagram and no professional account like LinkedIn?
Right. Look, it's your personal choice. It's not that, if it's not there, you have to go and create it. Not necessarily. If you just have one, it's okay, But if you had in the previous, make sure that you mention that on your visa form.
Okay. What can I do if my J1 visa has been rejected from abroad? So probably, citizen of one country living in another country applied for J1 from that country, got rejected. What do you recommend?
Well, I always suggest and say that, it is very important to apply for your visas from your home country. If you work, let's say that, because I also deal with a lot of students, they have their parents living, let's say, in Kuwait, or they're in Qatar or in Dubai, and if they've been staying there, if they're a resident of that place, they can apply for the visas there as well. However, if the visa gets refused, unfortunately, in those locations or at those locations, they can come back to their home country and then apply for the visas from the home country as well. Because the idea is to show your ties to your home country, your intent to return back to your home country. So it's always good to come back and apply for a visa from your home country.
Okay. Clarification on Afghanistan, as I already mentioned, it is on the no travel list, but you have to do what you can do, including remote rotations, remote research, because sooner or later this ban is going to be lifted, hopefully soon, then late. Then the other question is, and again, someone is asking, should I reapply for B1, B2 or F1 this year? F1 needs, the intent is different. So I don't know why this question, F1 is a different visa, as you all probably know.
So I'm sorry, can I,
yeah, of course. Yeah.
Right. So what happens is sometimes the person applies for a B1, B2 and his visa gets refused. And then they start looking at options, otherwise a B1, B2 for a rotation. So they would possibly be looking at maybe a master's in public health or master's in hospital administration. So I would suggest and recommend otherwise. I would say if you've been refused a B1, B2, don't jump on applying for an F1. It's not a good idea. Then you're telling the visa officer in one way or the other that my first decision was incorrect by applying for a different category. So you're putting that doubt in the visa officer's mind by yourself. So please don't do that. Right? If you've applied for a B1, B2, stick to that. And like I said, maybe there's a fundamental mistake that you made during the interview. When you go in for your visa interview, reflect and then start preparing for your interview that shows your intent to do this rotation, which is very important for you. And then how do you lead that towards your eventual professional goals? So please don't jump between these.
So the other question, I guess, related is, let's say my visa was denied a month ago, and do I have to justify why it was denied? And what do I do next time? Do I have to justify the denial, or how does it work?
The first thing is most of the time when a person goes in for his interview and unfortunately the visa is refused, they would only, that's what I've understood is they would possibly just remember the last question, that what the officer asked, and they assume that because of that my visa got refused. That's not true. I mean, we have to look at the total interview holistically and figure it out. The next question that you asked was, what I need to do is, well, because you do not know why your visa got refused, the only explanation is, again, putting your strong points ahead, right? Not just applying for the visa, but also justifying that, why you're reapplying and how would that actually help you in building your career forward from here. Okay. So make sure that you tell the officer that, you really worked hard. You've applied to various places. You've got, the rotations that really matters for you, and how would that actually help you. And at the same time, also show your intentions to do a specialization. You must not only focus on the USMLE. When the officer is saying, are you preparing for USMLEs? Your answer should be, sir, I would like to, specialize, let's say, in cardiology. I'm also preparing for my NEET PG and also for USMLE. So what you're doing is, by giving an answer like that, is you're shifting the focus from US to your specialization, and which is a fact, and you are probably going to the US to get the best of the education, to specialize in a particular area, to, have a better career growth once you return back.
Yeah. And just to point out to everyone, each case is different. So these webinars, we can only give high level suggestions without looking at your case. So if you really are interested, you should talk to Mr. Kaushik directly. But maybe we'll take one more question, which is, let's say I have a residency on J1 now, right? What is the strategy for the interviews? Obviously, it has to be different than B1, B2.
Right. Yeah. So that brings me to a very, very important point. What I've seen, Pavanji, in the last couple of interviews, that obviously when a person gets a B1, B2, right, they tend to go to the US and optimize their stay there by staying there for almost 5 months or less than 6 months, right? And then when they go in for their J1 after the match, the visa officers are currently asking them, what were you doing there for 6 months, right? So please make sure that you have a clear justification, and also it should match up with your first application, the DS-160 that you mentioned. Probably you mentioned there that you want to go and stay there for a month or 2 months. And if you stayed there longer, then you must have a justification that you got your rotations while you were there. Very important point that Dr. Amit mentioned, that, while you were there, you can also do a lot of networking. And also you also get in touch with the pharmacists to understand how the medicine and the medical industry works, and the lectures. Bring those elements there. that while I was doing my rotations, I was introduced to these seminars where I got the introduction on how the pharmacists work, how the medicines work. You have to justify your stay because the officer believes that you told them something and you did something else.
Yeah.
However, coming to the point, how do I qualify for a J1? Once again, you must understand what's happening in India. What is the medical industry doing? What are the ailments that are coming in? And how you can use the research or the residency that you'll be doing in America. How is that different from here? And the use of technology for better diagnosis, right? To make your career better here. So always connect it back home.
Yes.
And like Pawan said, every case is very different. Every person is very different. The personalities are different. So, one-on-one sessions are really important.
Yeah. And I think you answered a question. Why do J1 visas also get rejected? This is I think a very clear indication of how, because someone was asking why J1 can get rejected, and I think you answered that. Maybe we will take one more, and I understand there are a lot of questions on visas, so maybe in about 2-3 weeks we'll do another session. This is not something that all kind of questions we can handle in limited time, but again, this one-on-one advisory will really help you. But let me take one question. So one student, and it's a Sarthi student, I think, is asking, I had asked for a translator as part of my B1 application. Could this, and I think this goes back to the language issue, could this be the reason that the visa got rejected? And if I go back again and they ask about the past rejection, what should be my answer?
Okay. So
I didn't know you could ask for a translator. I didn't know that.
Yeah, one could go and and yeah. So there are a lot of people from back north, down north. So they are looking at going in there. The visa officers probably couldn't understand, but especially for students, going in for F1, M1, or J1, or for a B1, B2, a doctor who's going there for rotations. Like I said, asking for a translation is inviting trouble. So that's one. However, I do not know what were the questions asked and what led to another. Again, it's very open thing for me to say. Was that the only, the decision making for the visa officer? Very difficult to point out, However, yes, it creates a doubt in the visa officer's mind that why would I send somebody who's not able to take this interview for 2 minutes to go there and do rotations and talking to patients?
Exactly. Yeah, it's not the parents it's not others. Yeah, I see that. Okay. All right. Well, thank you, Sanjay. Appreciate your time. And I will take other questions, non-visa questions. For visa, we will have probably another webinar very, very soon. So thank you, Sanjay. Appreciate your time. Thank you.
Thank you so much. Thank you, Sarthi, and thank you, Pawan, for organizing this. Great. Thank you so much and good night.
Thank you.
Good morning from
all right. Let's go back. And if you have non-visa questions, I'm here to answer. Would a visa support letter from organization like Sarthi or do I need from the physician? So as I had mentioned earlier, and Reshma can post that link again, we do offer from various, if the physician like Dr. Korea offers a letter, you can take it from him, or we have our own law firm in the US or Sarthi. So it's up to you wherever you want the visa letter from. It's in 3 categories. Again, just to summarize, there are a lot of tele-rotations. There are a lot of discounts at this point on tele-rotations and remote research. So Reshma, if you can again post that link of the Google sheet that you can look at. There are limited spots available for those of you applying in the match this season. So gold, platinum, our plans. And we do go over each one of these things, each aspects of the match we do cover, in our classes. So should you do tele-rotations? How will it impact? Should you apply to multiple specialties? All of that, right? So that is also something that you can kind of go over. Any other questions you have on the upcoming match, and even if you have for the the match 2 years down the lane, because again, it does not mean that the visa situation will not change, because I did see questions from Iran and Afghanistan. See, situation and these policies change every 6 months to 1 year, right? We have seen it in COVID. We have seen it in 2016, 2017. This is one situation. It will change. You just have to be prepared. Like I said, be prepared. Take your step 1, take CK. Look at our flexi match plan. So Sejal can post that link. So it does not mean that the situation will remain the same and that you will not be able to match. It just may take more time. And like Sejal just reminded me, we do have, like I mentioned, our open Telegram group, and all your questions, not the visa questions, but all your other questions, we can answer there. Dr. Shreya Dutt, who's a panelist, She will be answering that questions starting next week as well, right? So we do also have Instagram, of course, YouTube. So check those channels. We do keep posting updates. I work closely with Sanjay and our US lawyer, and we keep posting updates on the visa situation as well. If you need help with your profile that we can review, we can tell you what all to work on. That is also a possibility, even if you are applying in the next season. So we have a lot of options next season, 2 seasons down the line, whether you're just starting, you started your MBBS, you have a long-term plan. That's our flexible match plan. So all of that is available. So if you have other questions, I am happy to be here for the next few minutes, and we can answer. List of students that match with just Tele-rotations, we of course can only share whatever they've publicly shared, which is YouTube videos and all that. I think Sejal shared a couple, and the others also we can share. But yeah, it's a reality. It happens. IM, pediatrics, FM, neurology. It is very hard to match only with Tele-rotations, frankly, if you are applying for general surgery. That's very tough. Pathology can also be done, as only Tele-rotations. But surgery or any of those fields will be very, very hard if you have only Tele-rotations. So surgery, OBGYN, etc. are going to be hard. What other questions can I answer for research, rotations, or the upcoming match? If you have any questions, happy to answer. Otherwise, oh yes, one I did want to remind you, we do have a webinar next week. Sejal, probably you or someone can post a link. On this webinar, we will talk all about how do you bring your profile together, whether it is your ERA CV, whether it's your personal statement, everything about your application. So for those of you applying next season, we do have a webinar next Sunday, which is 15th, I think. Yes, next Sunday, which is 15th. That link, Sejal, if you can post. Yes, you can register there. So all this has to come together, right? Whether you did Tele-rotations, whether you did research, whether you are applying this season or next season, you need to understand what IRAS is. IRAS will open on 24th of June, but you need to start thinking about it, especially those of you applying next season. So mistakes that we have seen in the IRAS CV, in personal statement, all of that, we will be talking about next season. So like I said, we do have special classes on each one of these. So if you go to our classes page, you can actually also see trailers. These classes are not on YouTube. So take a look at that trailer of all the classes. But next week, we'll talk about IRA CV, personal statement, how do you put your Tele-rotations research, etc. on this. Questions on ECFMG pathways, when will they open? So good question. ECFMG has still not made an announcement. It should be next week sometimes. 24th, I don't know if they are opening on 24th, but it should be sometimes in June, and we'll let you know. How to secure postdoctoral research with zero research background. So there are various ways to do it. One, of course, is to get some experience with the tools, statistical tools. That's always helpful. Second, join some research course. I mean, there are research courses online which you can join and probably, get some experience and put it in your CV that you have done this research. So we also have remote research. So once you build that background, then you can apply for the postdoctoral research or something similar. But to be frank, as you all know, fundings have been cut. There's a lot of issue that all programs are facing with funding cut. Probably remote research at this point is the way to go, right? So, but like I said, you can only start. So start with remote research. You may get a position, and if you get a position, then you can decide. All right. If nothing else, have a great rest of your weekend. And again, we will have more webinars on visa, and we will talk more about the IRA CV and PS in the next webinar. Okay. So I'll keep this chat on for you to grab the links. I'm sorry if I missed any visa question. I'm not the expert, and that's why I didn't take that question. So we'll probably do it next week, or when Sanjay is back, or one of our US attorneys is back, we can take the visa questions.
Thank you so much for watching. We hope that video provided valuable insights for your journey. Don't forget to subscribe to our YouTube channel and follow us on Instagram and Twitter. And check out our website for details on how we can guide you to a successful match.